Hi, I'm Dr. Perry Lin, and I would like to talk to you today about polycystic ovarian syndrome as part of the video series for the page Obstetrics and Gynecology Quick Summaries. Polycystic ovarian syndrome is an extremely common condition affecting many American women. Up to 6 to 10% of American women are afflicted by this condition. It is also the most common reason for American women to have irregular or a complete absence of menstruation. Current theory about PCOS is that it is caused by excessive insulin in women predisposed to this condition due to genetics. However, this is still incompletely understood. So how is polycystic ovarian syndrome diagnosed? The most common criteria uses a Rotterdam criteria of 2 out of these 3 following conditions. These include a chronic irregular or absence of menstruation, reflecting absence of ovulation of 6 months or longer. The second criteria is the manifestation of excessive male-type hormone clinically, such as acne or facial hair, or that this elevation of male hormone is confirmed by a blood test. The third criteria is the appearance of polycystic ovaries on ultrasound that gave rise to this condition's name. In addition to the above 2 of 3 criteria for diagnosis, there has to be absence of other identifiable reason for the irregular or absent menstruation. This slide shows the typical polycystic ovary as seen on ultrasound. On the right is a normal ovary shown for comparison. On the left, you can see that there are a marked number of small cysts that form a ring around the periphery of the ovary in polycystic ovarian patients. These are the results of failed ovulation that did not progress to making an egg. Usually there are 10 or more of these small cysts. This is extremely characteristic for this condition. This next slide shows the excessive testosterone manifestation clinically in the form of excessive facial acne in a woman. The degree of acne is variable between different patients. This next slide shows the other manifestation of excessive testosterone activity, that is excessive facial hair. Again, the degree of excessive facial hair is variable between different patients. Polycystic ovarian syndrome should be considered a fairly serious medical condition, made more serious because of underdiagnosis for many patients. First, with the absence of regular ovulation, these patients would eventually experience infertility to some degree. Second, the absence of regular menstruation could lead to uterine cancer even at a young age. Then, the excessive testosterone, which causes acne and facial hair, could cause major cosmetic concerns in many women. Finally, more than 90% of the patients with PCOS have obesity that results in their excessive insulin. This combination of excessive insulin and obesity would eventually lead to diabetes, heart disease, hypertension, hyperlipidemia, and other metabolic conditions. Polycystic ovarian syndrome management requires specific therapy for each of its complications. Reproductive endocrinologists are usually best suited for management of women with this condition. The infertility is usually managed by ovulation induction agents. The irregular menstrual cycles are managed with combination of contraceptive pills, which are also excellent in suppressing acne and facial hair. Additional androgen blockers could be used to further manage the acne and facial hair. Medical issues such as hypertension, heart disease, diabetes, and hyperlipidemia are best managed in conjunction with a family practitioner or an internist. So, in conclusion, PCOS is an extremely common chronic condition with many significant medical implications. Diagnosis is frequently missed for a long time in individual patients. The underlying pathology seems to be excessive circulating insulin that is further exacerbated by obesity being frequently associated with this condition. However, with appropriate management, women with PCOS could avoid many of the complications associated with this condition. Thank you for watching this video on polycystic ovarian syndrome.